Most patients with back pain are best treated non-surgically. There's a very limited amount of disease conditions that surgery is indicated in treating when it's purely back pain. Now, patients that have back pain in combination with leg pain, oftentimes the leg pain component is very treatable. We typically would want to consider surgical intervention after we've exhausted all of our conservative treatments, and that would include something like physical therapy, possible steroid injections, non-steroidal use. There are certain conditions which respond extremely well to surgical intervention. Patients with nerve root impingement syndromes, either by a disc herniation or a bone spur, have excellent results in relief of either their arm pain or their leg pain. A common thing that we see in the neurosurgery practice is patients that have pain down the backs of both legs when they try to walk or stand, and that pain is relieved with sitting or bending forward. This is a very common problem in the patients 60 years and older. It tends to come on gradually, and it can really be a limiter of their quality of life. There are certain non-surgical treatments we can try. A lot of patients typically will fail those over time as the symptoms worsen and the disease process worsens. And we can treat that successfully, oftentimes with either an outpatient minimally invasive laminectomy, or depending on their specific anatomy, they may require a more involved fusion type procedure, which is typically a day or two of a hospital stay. Both of those groups of patients, though, with very high percentage rates, will have relief for their leg pain. In my practice, I do majority of minimally invasive spine procedures. And we have at Community East developed a very novel plan for treating postoperative pain. I work very closely with pain anesthesiologists who do some really state-of-the-art blocks. And so we're able to do minimally invasive lumbar fusions, and patients are only needing to stay either 1 or 2 nights in the hospital, which is really unheard of compared to where things were just a few years ago. Typically, patients just a few years ago would have to stay in the hospital for many days, even a week, and this has allowed patients to get home back to their own surroundings and to be relatively comfortable, which is something I think that Community offers. I don't believe that the types of procedures and the innovative blocks that have been developed at Community are available any other place in the city.